people.
Every time you guys learn something, as David says, you know what? Sometimes maybe one word can change everything, all your practice. You know, I go to the classes, I spend $600-700, and you listen to the guy, you just like sitting and like, oh my God, I already know this. Why I spend so much money? And like one word can change everything. And you just like, whoa, he's telling me something, and now I know, because it's create that puzzle. Because one teacher can tell you one thing, another teacher can teach you another thing, and when you put all this together, it makes sense, right? So
there is something that I don't know if I should be saying anything.
Yeah, no, we're good because
there was something you said. It changed a lot for me. One thing you said.
They're not gonna hear you. You need a second microphone.
Oh, okay. Well.
Okay, so today we're gonna talk about shoulders. Shoulder. Why it's most movable joints in our body, and we know we grab with our arm, we pull. The shoulder have to be healthy. The shoulder have to be strong and mobilized and stabilized too. Because if shoulder not stabilized, we got a lot of dislocate our shoulders. And if shoulder is not mobilized, we also can't do specific like motion action in our life. And what's going to happen? We're going to injure ourselves. As usually what I'm saying, we not just look at the shoulder itself. We look at the whole spine. We look at the spine. We look at the neck. We look at the ankle. We look at the everywhere, because you one piece. And guess what? Even if your ankle is not like stable or mobile, it can be caused, and it's go all the way up. It's go to your hip. It's go to your lower back. It's go to your thoracic area. It's go to your shoulder, and that's what the problem. Most common thing for people, it's rounded shoulders, anterior head tilt, and loose lack of mobility in the shoulder. So we're going to start from beginning. Let's talk about spine connection between lumbar, thoracic, and neck. As you know, the lower back have to be stable. This is the most action right here, stable. As you can see, let me get to my other spine. On that, if you guys look at the spine, the lumbar disc, lumbar vertebra being designed specifically, all this 1, 2, 3, 4, 5, 6, 6, 2, they design differently than your thoracic area. And guess what? Why it is built differently? Because this lumbar area have to be for stability and for the power. This is where why? Because all this weight is coming on you, right? Everything is come to you. So this one have to be strong. And most of the time, it's not. It's become weak. It's become pain. Why? Because we're on level. We're sitting all different like leaning sides, and it's create problem. So next one, it's a thoracic. And thoracic, it's the most movable part of your body. I mean, right in here in this chest area. We have a 12 vertebra up here, and they have to be mobilized. If they not, guess what? They lock it in. Your shoulder get locked in. And that's what the problem. So people sometimes focus on the shoulder pain, do all those tests, they find out the problem, they fix it, and there's still pain in the shoulder. Why? Because they still forgot this thoracic area. This is how they all related. If lumbar area too mobilized, too loose, possibility you get locked in here in your thoracic. Why? Because you try to look around, and if this is stiff upper body, cause the problem. Now the shoulder, same. If you round it, if you locked, your shoulder, your scapula is slide forward, correct? It's slide forward, and if you like this, you try to do something, you get injure yourself. Why? That's because that scapular, that humeral bone go inside that socket, which is this go inside the scapula, and this is the whole shoulder. We're going to talk about this in a minute. So if my scapula slide forward, and I'm, like I said, try to do something, in the beginning I might do some compensation, but later and create an injury, right? Because you overdo some specific group of muscle or ligaments, it's not balanced. So that can cause a lot of issues. So I'm not just look at the shoulder, I'm look at the whole spine. And if a person come in like this, like shoulder, and say, oh, I have a shoulder problem, And if you're going to work on that shoulder, it's not going to help anything. Why? Because you see, the hips in uneven, you kind of lean. It could be rotation in your spine. It could be rotate the whole ribs. It's kind of jammed. Get that scoliosis or upper cross syndrome, lower cross syndrome. So, like I said, look the whole spine, and that's the idea. See this relationship between lumbar, vertebra, cervical, and shoulder. All right, so next one, what I want to talk about, it's shoulder structure. As I'm already started, this is the scapula. It's really, like I said, need to look at that scapular position. And if this is go away, or sometimes you can see this like that angle of the scapula, the lower angle of the scapula is going to rotate out. What's that mean? That's mean the muscle is stretched. This muscle is get tight because people doing this all the time, shrugging in this stress position. And that's important to take a look. So scapula. So we continue learn about the shoulder. Today we're going to talk about the shoulder structure. So we have a scapula. This is the most important because the scapula is, I think it's support and hold this humeral bone inside that socket. You can see this glenohumeral joints right in here, the ligaments around, and this is the humeral bone. So our arm, you can see it, and this is the scapula with the coracoid, acromial in the back. So this is you see that groove right in here. So it's a superior part of our scapula and inferior part of our scapula, the scapular angle. And this is what we need to know about this. It's really important to pay attention to all those tiny joints between your clavicle and your acromial. Also, those attachment, all those ligaments attached to the coracoid or clavicle or acromial. And like I said, look at this, all the surrounding ligaments. Sometimes you can turn them or do some damage and you don't know about it, and it constantly create the pain. So the physical therapist or massage therapists know those tests. They do those usually tests. They find out the problem, which is ligaments being turned or which muscle is being non-active and what's going on with the shoulder. So idea is restore that with the manual therapy. Now, it's another aspect of this. So check all the time ligaments, the motion, of course. And I will show you another one. Of course, it's a lot of vein, nerves up there. I don't want to go there. I just want to add a little bit nerve system. And what you see up here, okay, here we go. Let me turn this around. Perfect. Just like that. Look at that. It's coming from your cervical area, C3, C2, C4, and go all the way down. Look at that. Yeah, lateral cord, nerve, and it's come right on this. If I'm adding ribs, let me add ribs. Here we go. Take a look. It's go right onto that first rib, a little bit second rib between your clavicle, under your coracoid, and go all the way down to your arm. And it could be the problem up there too. So when people come in with tingling arms, numbness fingers, all that stuff, it could be the most 90% is going to be problem with nerve connection. Something pushing, maybe the first rib, maybe a clavicle, maybe your shoulder is elevator up. You need to find this out. Maybe sometimes people limited on breath. It's maybe rib been broken and it's get that stiffness around this area. So really important to pay attention to all those aspects. And of course, if this is index finger, the big thumb, and middle finger, it's going to be the medial nerve, and the radial nerve, it's a pinky and the ring finger. Of course, we also not forget about ulnar nerve. This could be the possibility damage too. Carpal tunnel present too. So it's a lot of connection up there. I will highly recommend pay attention to this area, to the shoulder. It's really important. You can see that, okay? As we know, we have inferior part of our scapula and superior part of our scapula. It's a top. We have that nice kind of groove. This is called spine of the scapula. And sometimes when you work on that shoulder blades, when people like very sensitive muscle like infraspinatus or supraspinatus, it's really important to pay attention to this. Next one, it's a acromial process. So this is a acromial process. It's come right in here and it connect to your clavicle. We're also going to talk about this leveling and how palpate the clavicle to your acromial. And of course, coracoid. It's right in here in the front. If you guys, I'm going to show you the video close to the phone. We're going to look at the round. It's important. Why? Because it's so many ligaments and they connected between each other. You know what? I'm working on my BMW car, and when I take my tire, I see all those suspension, where there's all those connection, like sensors, joints. And when I'm looking at the shoulder, I'm like, wow, this guy who built this BMW probably take a look on the human shoulder. So he's probably designed that car by like a human, like a car, that the suspension of the car for BMW. Look like it. So ligaments, a lot of problem with the ligaments too. A lot of people torn ligaments. Why? Again, disbalance, because so many muscle support and keep that shoulder in balance. And if the shoulder not balanced, problem, right? So today I'm going to talk about this coracoid humeral ligament. It's really important. This is a ligament attached with your humeral bone and a coracoid in front, right in here. I'm always, when I push on this coracoid, people like say, oh, it's painful. So be careful with this area, coracoid. Let me right here. You can see this red spot right here. So this is muscle attached also. Which one? It's a pex minor, very sensitive muscle. If you go work under that pectoralis minor, we're going to do this today. People very sensitive on this. Why? Because rotation right in the shoulder, it's rotated, contract that pectoralis minor, major, create that stiffness, dominate muscle also, it's pulling forward, and that's the issue. So this ligament is really important. We're going to do a couple tests. If it's painful, you already know it could be a rotator cuff problem. Next one, like I said, it's a coracoid, acromial. Between coracoid and acromial have a ligaments too. We have a lot of glenohumeral ligaments, which is hold that humeral bone inside the socket of the scapula in that balancing position. And if it's no balance, it's going to be pain, it's going to be problem. And if you're massaging, you can like mobilize it, clear this out, and people come back in 5-4 days back to you, right? They say, oh, I got shoulder pain again. And you look at him, it's the position of that shoulder, whatever, rotated forward or elevated. So we need to give him homework. We need to get those exercise. It's a part of the treatment. Next one, I want to talk about acromioclavicular ligaments. It's between clavicle and acromial. It's also sometimes painful. That's what we're going to do the test. I'm going to show you how to do test. Usually you come in and person standing or sitting, and you kind of place your two fingers on that acromial process and 2 fingers on that clavicle, and all you do start pushing down like this. And if it's big dumb, that's mean we have some problem up there. And usually people feel pain. Also need to be careful with this. So let's skeleton system. You guys understand all this skeleton system? So it's what we're looking for, it's a clavicle, humeral bone, scapula, and sometimes that first rib, because sometimes that first rib, I will get there in a minute, also can affect the pain in the shoulder. So people feel it's a pain, it's a shoulder pain, but it's not. It's sometimes that first rib pushing on those muscle or against the clavicle, and it's create that pain, like a pulsation sometimes. Also can push on the nerves. We're going to get there in a minute. So also look at that first rib. It's important first rib. All right, so muscles.
Show you the muscles, how many muscles up there, and how this everything is keeping in balance. And guess what, if the posture is poor, if one muscle is dominate than other, some weakness or glenohumeral joint problem, it's always going to be that pain, discomfort. You can move that shoulder. So check this out. We have a deltoids muscles, anterior mid deltoids and the posterior deltoids. It's pretty big muscle, but I want to turn you around and show you this huge trapezius muscles. So huge trapezius, medial trapezius, and low trapezius. Big muscles. Is that lats attached to our shoulder? It's attached to our arm. It's possible rotate your arm, or non-supported. If your lats is weak, it's let the arm go and rotate forwards. Why? Because we have this super dominant and strong pectoralis muscles, especially for the male. They always constantly do the bench press. They create that massive muscle. It's a so huge muscle, and it's dominate. It's rotate your arm forward, which is create this glenohumeral joint problem. Let me turn around, show you a couple more. Infraspinatus and supraspinatus. This is really good muscle to focus on for massage therapists, for physical therapists, and for personal trainers. It's a lot of issues up there with this muscle. With all this rotation, with poor postural, that can cause a lot of problems, and it's a lot of sensitivity there. Let me cut this stuff from here. So we're going to remove trapezia and deltoids. Just show you the hand packs. Let's remove the pack and platysma muscle. So take a look how many muscle attach to the glenohumeral joints. This is a pec minor, very, very sensitive. If this is contracted, if you kind of slouch forward, this contracted, it's really hard to rotate your shoulder back, create pain, a lot of discomfort. Need to work on that muscle. So take a look. This is the supraspinatus, and this is infraspinatus. Every time I work right on that scapular groove, right in here, people get very sensitive. So I'm trying to bring that shoulder back all the time. A lot of pay attention to this biceps. If the biceps tendonitis, it's create a lot of inflammation up here. Also, pay attention to those ligaments. Do a lot of tests before you work on the shoulder. Make sure you will find out where the problem is. All right, so that was let's cut deeper. So you see that teres minor. Here we go, teres minor right in here, attached to the scapula. Also work like deep work. Subscapular, this muscle is really important. A lot of adhesions up there, a lot of scar tissue, and it's very important to work on that. Let me cut that biceps away. Yeah, I see that biceps. Oof. Teres. So I always try to go right in here, just apply a little pressure, and people rotate around. So make sure you don't push too hard, you don't feel this pulsation, and you should be good. All right, so this was the class. So subscapular, a lot of arteries and nerves. We very gently ask them to move around and see how they feel. If it's like very sensitive, laid up, and maybe find another way to create this mobility in the shoulder.
So many muscles up there, so many muscles. I'm gonna add this 3D video on this on that class so you guys see it. The main muscle, it's a pec muscle, minor, major. Why? Because they attach to your clavicle, attach to your ribs, and to the coracoids. This is the balancing. From the other side, what we have from other side? Tell me.
You're talking about
Yeah, back muscle.
rotator cuff.
Rotator cuff muscle. So if we have,
Infraspinatus teres minor.
yeah, we have a trapezius muscle, right, which is holding all the scapula in a balance. If I have a pecs up here, I have a what? I have a lats a little bit. I have a rhomboids. I have a infraspinatus. I have a supraspinatus. To make sure that humerus bone is not going to rotate, we have a deltoids muscle, right? We have a anterior deltoids, middle deltoids, posterior deltoids. Important. We have a subscapular, which is under the lower layer, even under the rhomboids. So trapezius first, mid trapezius, lower trapezius. We have elevator scapula. Under, we have more muscles up there, so many layers. And this is try to stabilize that shoulder. And guys, if like I said, if one group of muscle dominate, rotate, this is shoulder not unbalanced, and that's going to be a problem. We're going to do some tests. I'm going to show you how to do them and how to identify the problem. Also, biceps tendinitis also can affect the shoulder. What else? We already talked about subscapular muscle, neck muscle.
Supraspinatus?
Yeah, infraspinatus, supraspinatus. It's a really sensitive muscles. You can see this on that scapula, that redness. This is infraspinatus and supraspinatus right on the top. And it's how to find supraspinatus, infraspinatus. If you find that region, like a ridge, under, this is the infraspinatus. And over, this is the supraspinatus. Very sensitive muscle, especially with people, those rotator shoulder. I like to do that. People like, my shoulder's in pain. What's going on? And I'm just like, start working on that infraspinatus. I'm attached, and that's it. People are like, whoa, it's right there. It's right there. Why? Because it's rotated, right? And it's always kind of stretch. Get those people call this trigger points, but it's just unbalanced. All right, let's talk about nerves. So we got the muscles. So many muscles up there. Why? Like I said, it's like a German car. So many stuff to stabilize that. And if we don't pay attention, trouble. Next one, nerve connection. We got so much nerve coming from our neck, from C3, C4, C5, C6, and go all under your first rib, between your clavicle. Let me turn up here. Go close under your scapula and go all the way down your arm. And if people feel tingling, numbness in the fingers, what's that? What's it could be?
Brachial plexus is being...
Could be, yeah. So we have so if you feel tingling, numbness, your hand is go sleep. You wake up, your hands is go sleep. You're riding, you're sitting, you're driving. That could be something pushing against those nerve. And most of the time, yes, it could be the first rib. It could be in the shoulder. It could be in your elbow, and sometimes even in your wrist.
What about neck?
Yeah, it's coming. Yes, neck too. Neck too, correct. So sometimes it's a neck problem and it's go all the way down. And people start treat the shoulder and it's nothing changed. So I always, like I said, the video today about the shoulder, but I always treat the neck and shoulder together. It's like a whole body, correct. So all those nerves come out from the neck and go all the way down. The most pay attention, it's a medial nerve, radial nerve, ulnar nerve, and brachial plexus nerve, correct. So postural assessment. We're going to do postural assessment. I'm already start talk about this. I want to see the level of this acromial process. I'm always stay like this, put my fingers, and see the level of this acromial. Is that mean the shoulder is high or this one the shoulder is down? Could be, but could be not. It could be the spine is already changed. Maybe you have scoliosis, you know. Maybe people sitting like this or walk or they rotate it, you know, kind of like that. So you need to pay attention to this. It's not. Also, I'm looking at the ribs. How's the ribs? And like I said, position of the scapula. I look at the level of the scapula. I place my fingers like that and see in a standing, sitting position, and lay down position. So I do sometimes 3 position of the scapula check. So next one, assessment. We're gonna do this in a minute. Of course, special tests and palpation. It's important to do palpation. Sometimes it could be the mobility problem. It's a soft tissue, and it's good to know how to check those. All right, so we're gonna have shoulder people. I think Marina is gonna be the shoulder, right? Yeah, she's got. I mean, you guys, whatever. Who wants to come in? David, she's good. All right, so. We start doing our first. It's let me take the JB away. Like the shoulder, it's really cool class. It's a lot of stuff going on, and let me see if we still. Oh, we're not shooting anymore. Why is that? Oh, we wasn't shoot anymore. But that's all right.
You got it on that one.
Yeah, that's fine. Yeah, I'm gonna start now. Perfect. Where are you going? Oh, she watched her hair. You see, she don't watch how your shoulder is. The girls with hair,
is more
lips.
important.
Yeah, that's the bullshit. When people come in like this,
And my hair.
yeah, and they still take care of the hair. I'm like, get out of here. Just go. I'm not gonna take care of you because I spend the time and okay, let's come up here. Let me stay up here. All right, so shoulders. No. Face towards the camera. Sorry. I want to see if she's not going to be without shoes. So no shoes. I don't want any compensation. And what I'm looking for here, I am going to look this level of the shoulder. So I place my one finger on this shoulder, another one on here. So place it right on this coracoid, right in here. So what do you see, David?
I see that the left one is higher.
All right, so let me double check. And yes, he's right. So left one is kind of higher. So this one is higher. Also, I want to look at this line. If I'm drawing line through the mid of the ear, through the middle of the body, and see where is the shoulder is. So what I'm looking for, she's pretty good. I see a little bit tilted, but most people, it's just like that. So that's meaning the head is tilted forward. It's called upper cross syndrome. We already know the weak muscle and stretched muscle and hypertonicity muscle. So pecs is going to be tight. The rhomboids is going to be stretched. The scalene is going to be scalenes, and the neck sternocleidomastoid is going to be tight. Other muscle is going to be weak. Although, like I said, it's in our book. It's so many videos about that. You know which muscle you need to work on. Okay. So next one, I'm looking for. Yeah, the head position. Of course, I'm looking for hips, but for the shoulders, I'm already checked those levels. Now, what I want to check if this shoulder is moving around, the mobility. So what I'm doing, let's turn this way. I ask her to squeeze thumbs like this. And all you do, just go one, and I see the distance and how she get there. You see, she said, no. Squeeze your thumb, because they try to compensate. And go switch, and look at the switch. I see if the head is coming forward. You see this little bit struggling up here. I'm looking for her palm. So what I'm doing, let it go. I measure her palm, the distance from right in here to all the way up to that longer finger. I think it's a mid finger. That one, all right? So that's the finger. So I measured that, and it have to be right in here. If it's okay. It's a normal mobility if you place her palms up here, and that's a distance. If it's greater, it's a bigger, that means she have a problem. And like I said, I also look if she's doing this, if her arms start doing that, and that's what that tests. We got a bunch of tests. Next one, I do special tests for my customer. My special test, it's a simple test. I ask the client, usually just raise her arm up and down, just like that. You see my thumb is forward, up and down. Good? No pain. I always ask about pain. If the pain comes up right here, 60 to 120, right, like in this range, that's mean, yeah, we have a shoulder problem. But sometimes it's clear out after 120, it's like boom, and it's good. So it's clear out, it's definitely something going on up there. And also I look the whole rotation of the shoulder. So I see how she's rotated. Right there a little bit. Is there any pain? No. Yeah, she have a good shoulder. What about this one? Because this one is elevated, right? No pain, correct? Perfect. Sweet. So she just did test. Next one, special test too. I ask people place that arm right in here and raise this elbow up without raising this. Up. Is any pain?
No.
Good. Switch. Yeah, she's always stay kind of close together. Let it go. Feel pain. Okay, perfect. Next one, I'm checking the whole, like a strength. I'm apply a little bit pressure. This is called bottoms up. I get this arm at 90 degrees. Get that right in here, 45. So this is the 90, 45, 0. Thumbs up, and I ask her to push up. Is any pain?
No.
Good. Sometimes those ligaments between your clavicular acromial ligaments cause pain if you do this test. Next one also, I push. You can do push inside this way. Is any pain?
No.
Push outside. No pain. Next one, I want to check subscapular muscle. This is another test. It's easy to remember. You bring this arm right in here. Get away from the bottom, let me show you this way. Away from the body, and she pushed towards the body. Is any pain?
No.
No pain. So her shoulder is good. We should treat someone else with the pain, but that's okay. Next one, I want to check the biceps. I push you away. Here we go. Biceps. Biceps, I put this in the flexion, and I ask and push it down, and she kind of like try to do this biceps curl. Is any pain?
No.
Sometimes pain comes up right in here. So we have this biceps tendinitis problem. We want to pay attention to this, okay? Next one, we can do that, forgot the name. I think it's a sulcus test. Really important test. You come up on the top, place your hands, 2 fingers like this, and all you do, you not push too hard. You not try to like elevate. So my right arm is pushing down, and the left one, I grab that humeral bone, and I see if any like a lot of slacking up here. It's like a too much. It's like a up and down. That's mean what? We have a unbalanced ligaments in trouble. We get some maybe ligaments tear, and it's create the pain. So be really careful with this one. And yeah, it's a sulcus test. Now, here we go. I remember the name. Now, cross this arm and ask her to push away. So she's pushing that way. And if it's any pain, yeah, so it's good. She's completely good with the shoulder. The range of motion is good, but she still lose that mobility. You see that she can reach that. Why? Because she have thoracic problem. She don't have a shoulder problem. She have thoracic area problem. But we're going to treat her as a shoulder pain. All right? Next one, we're going to do some palpation and joint tests. We're going to do this everything on the bed. Okay? We're going to stop that video and reset the camera.